Hi, I am Dr. Kelly Daly. I am a clinical psychologist and assistant research scientist at the Family Translational Research Group at NYU Dental School. So, dental fear is any degree of, apprehension and worry about going to the dentist. There's a huge spectrum there in terms of severity. About 1 in 5 people globally seem to have dental fear, and that's 53 million Americans who actually go to the dentist on a regular basis. There is a significant portion of people with severe dental fear who don't even make it to the dentist. So we know that our numbers in terms of the prevalence are actually underestimates as well. It tends to cross-cut class, race, socioeconomic status. So it's a really ubiquitous phenomenon. Anybody can have dental fear, regardless of their degree of education, their profession, their wealth. It's extremely common. So dental fear can look like a lot of different things. Like any type of anxiety, there is a kind of a physiological component of it. So that can be elevated heart rate, difficulty breathing, sweating, feeling hot, and feeling kind of sticky and uncomfortable. And there's also a cognitive piece. So worry, kind of what's going to happen to me here. The dentist might hit a nerve and paralyze me, really catastrophic thoughts. And then there tends to be, in the worst cases, an avoidance component. So for some people, that means they just can't bring themselves to get there at all. So that's an interesting question. And there's no simple answer there. There are all different kind of pathways, if you will, to dental fear. So we know that most people with dental fear have had it since childhood. Sometimes it has to do with a medical trauma or a dental trauma experience early in life that kind of generalizes. Other times it's some, kind of uncomfortable experience that most of us wouldn't think would be that impactful, but it is. It can have an onset in teenagers, in adulthood as well. I've worked with several people who've had their onset in adulthood after, a particularly painful or bad experience. We also know that people who are kind of more wired toward anxiety generally have dental fear. People who've experienced sexual assaults or, situations where they've really kind of had no control tend to be very afraid at the dentist because they have some of that re-experiencing and having to cede control to another person who's really in their intimate space. People who have claustrophobia and panic tend to have dental fear for the same reason. It feels very enclosed and like somebody is really invading their personal space, and it can really cue panic attacks for them. So there is a kind of a huge spectrum in terms of what leads somebody to dental fear. And it's only a percentage of them that actually have to do with a prior dental experience. So the vicious cycle of dental fear is really the term that's been coined to describe this phenomenon where people say, you know what, it's just too awful. These very fearful people say, I just can't do it. It's going to be terrible. It's going to be so painful. It's going to cost so much money. It's going to be this really aversive experience. That's why I don't go to the dentist. So they have these negative beliefs. And then the negative beliefs drive this fear where they say, I'm just not going to go. I'm not going to go. And then when these people have an oral health emergency, so something that really can't be avoided, so losing a crown or having like a really impacted tooth, something that they just can't put off anymore, they go into the dentist. And because they don't do any prophylactic or preventative care and they don't go to the dentist regularly, it's a self-fulfilling prophecy. So they go in and they do have pretty aversive, painful experiences that are more expensive because this is emergency treatment now. And then for them, they go, oh, see, I was right all along. It is always that painful, that aversive, that expensive. And they go back to avoiding. So it becomes this cycle whereby, these negative beliefs and this fear really prevent them from going at all until something goes catastrophically wrong and they can't avoid treatment. And then because of that, the treatment they get tends to be very, very uncomfortable. And they go, yep, I was right. This is why I don't go. And we know that over time, there are outcomes for kind of more negative systemic health, more negative long-term oral health repercussions, quality of life can suffer. So the vicious cycle of dental fear is, it's really upsetting, and it also has all of these real medical repercussions that we can see in people. So so it's interesting. As a patient, some ways to combat dental fear are to really advocate for yourself and open up a conversation. So telling a dentist, or telling a hygienist or whoever it is at the office when you get there, I've had some negative experiences in the past, and then saying, what are the things that would make you feel more comfortable? For some people, that's saying, can you please tell me kind of just what's going to happen, not in extreme detail or anything, but what's going to happen for every step of this treatment? Or can you please tell me what a new tool is every time you pull it out, so I'm not just envisioning the worst case scenario? So for some people, that's helpful. Other people like to listen to a meditation or something. So requesting that they are able to put headphones on during certain parts of the treatment, so they don't have to hear the drill or something aversive. Communication is really key, because people with dental fear need to know and kind of be reminded that they're really in control here. They're not without volition. They are electing to go to the dentist and this dentist to get treatment. And that doesn't mean that, they just kind of suffer through whatever happens. They have a voice, and they have the right to know what's happening and be comfortable and consent to the procedures. From the dentist's perspective, I would say some things that are helpful are to know that people with dental fear tend to feel like they have no control and they don't know what's going to happen. Those are two of the most kind of common profiles we see. They feel like they have no agency, they have no control, and whatever is happening is kind of being imposed upon them. So really taking that patient-centered care approach and making sure that you're discussing with the patient what's going to happen for treatment. You have an agreed upon plan that you're both comfortable with. You talk through the things that the patient is concerned with, and you kind of come up with a system whereby that person can honestly communicate what they're feeling, if they need a break, if they're uncomfortable, if they don't like part of the treatment. So there's something huge in just kind of giving patients back some sense of control and autonomy. With kids, this can mean anything from, letting the kid play with the water flosser to picking the flavor of toothpaste they want. We work with this incredible pediatric dentist who tells the kids, this is your appointment. You're the boss here. So when you're ready, I want you to raise your boss hand. And he kind of gives the kid the agency to say, okay, I'm good every step of the appointment. And that's a really nice way to kind of give somebody back their sense of control. So that would, if I had like a theme for dentists to remember, it would be that idea of control, and how can I give this person who I'm treating more of a sense of it? How can I give that back to them a little bit? Because that is one of the things that starts to combat dental fear. There are, of course, treatments for patients who are on the more severe end. We do one, cognitive behavioral therapy for dental fear is extremely, extremely efficacious. It has effect sizes like we don't see with anything else. So basically, in a 3-hour treatment, you can be completely without dental fear. We are running a joint study through Penn Dental Medicine and NYU Dental, where we are doing a 2-step process for people with moderate to severe dental fear. The first step is a self-administered mobile app. So it's a cognitive behavioral therapy-based mobile app they do on their own. And the second step for people who need more is the one-on-one with a clinical psychologist or a licensed clinical social worker that's really catered to their own individual fears. And it's based on exposure and kind of combating those things that you yourself are most worried about, however idiosyncratic or individualized they are.